Next tonight, the mental health challenges of an African nation after 14 years of civil war. From Liberia, special correspondent Kira Kay has this report.
This Friday morning at a rural Liberian health clinic feels routine. Kids are getting their vaccinations. Pregnant women and new mothers are here for their checkups. Malaria tests are underway. But this nervous-looking young woman is here for a startling reason. In a private session,
anything really worry you?
She tells a group of visiting clinicians that she has trouble sleeping and feels insects crawling under her skin.
Pinch me.
25-year-old Nyama grew up during Liberia's civil war. She says rocket explosions shook the walls of her home. She saw dead bodies in the street.
When there's a rocket around you.
Counselor Laro Quay thinks Nyama's anxiety is caused by post-traumatic stress disorder.
They didn't molest after the war.
After the war?
Yeah, it came me with small bomb.
I think there is probably nobody in Liberia who was not impacted and experienced trauma as a result of the war.
Dr. Janice Cooper is a mental health specialist based in Liberia.
The research suggests that 40% of Liberians actually have experienced post-traumatic stress disorder, which is a very, very high rate of PTSD. There's a tendency when we think about the war and we think about trauma to forget that there is post-conflict trauma that continues to go on. Even today, there are people who regularly encounter their perpetrators.
Liberia's 14 years of civil war were a nightmare of atrocity and chaos. Rape and the use of child soldiers was prevalent. Very few Liberians escaped being either victim or aggressor. Now, 8 years after the violence, Liberia is putting itself back together physically. The streets are full of activity. New businesses are getting up and running. But Dr. Cooper says the trauma permeates.
Liberians tend to be extremely edgy and angry. And sometimes it's hard to understand why, because we're a very friendly, fun-loving society. But sometimes anger will manifest itself in something as simple as, people in the market and they're selling something and, the difference in price and who got there first and who didn't. And it explodes into something that's way out of proportion.
Despite the dangers a traumatized population presents in a still fragile country, Liberia has only one psychiatrist and a single mental hospital with a total of 80 beds.
We are the only inpatient facility in the country. So people who are desperate come from far away.
Rodney Presley, the director of the public E.S. Grand Hospital, says his facility receives the hardest cases.
We have schizophrenics, we have those with anxiety, a large number of young men who are brought here by family members, mostly for drug-induced psychosis. Just 2 weeks ago, a patient was brought in, hands tied and mouth gagged.
New arrivals are put under observation, administered what medications are available, and given counseling and group sessions aimed at preparing them for a return to the outside. One former resident is Bill Jala, who was institutionalized 6 times over several decades.
We had a relapse due to stress. In 1990, a relapse due to lack of medication, the wartime then.
So the war started and all the medication went away?
There was no hospital.
Bill was like many Liberians with mental illness, who remain sick due to lack of consistent treatment and who suffer the scorn of society.
I believe that mental illness is because of witchcraft. Also believe that because you are involved in bloodshed, and so you got mentally ill. So you have to live with that stigma.
So how have you been feeling since your last visit?
The medicine is doing fine.
Bill is finally on the right medicine and receives regular care on an outpatient basis. But despite such success stories, Grand Hospital is still struggling.
We are lacking adequate supply of medication on a consistent and regular basis. We are lacking mental health professionals. It would be great if we were able at this time to provide mental health services in the various communities in the country so that people wouldn't have to travel so far.
Liberia must balance many health challenges. Infant and maternal mortality, malaria, and waterborne illnesses compete for limited government dollars. But in 2009, Liberia added mental health care to its national policy. Dr. Bernice Don is the country's chief medical officer.
If people are not stable enough to do their work, it will affect our economy, it will affect our country, it will affect homes, it will affect families. It also has security implications. There's a large group of young people who have resorted to violence. They are in the street.
Dr. Don says the goal isn't to build more inpatient facilities like Grant Hospital, but to integrate mental health efforts into the country's 500 primary care clinics.
If you have it at a primary level, most of the basic things that do not need hospitalization can be addressed right there. And it's much comfortable for the patient because they avoid the stigma because they are going to the health facility like any other patient that is going to the clinic for treatment.
To implement its strategy, the Liberian government has turned to the Carter Center, created by former President Jimmy Carter and his wife Rosalind, a longtime mental health advocate. Dr. Janice Cooper, a Liberian who fled to the States during the war, has returned to lead the program.
We recruited a cohort of 21 students who were physician assistants and nurses in clinics and hospitals, as well as in schools of nursing, to be part of our first cohort of mental health clinicians.
Bipolar disorder is not one disease condition.
They spend many weeks learning about identifying and treating mental health disorders and all the major mental health disorders in Liberia. They learn all the basic tools that you need for screenings and assessments.
Be very aware of sound-alike, look-alike drugs.
They also learn medication management, and for some of them, this is really the first time that they're learning pharmacokinetics and how particularly psychotropic medications work in the body.
One member of this first class is 34-year-old Kwendi Appleton.
I wanted to be a part of that, being able to bring back hope to the hopeless. Seeing them, being able to go to school, to work, like any other person in the community.
Fresh from completing the program, Kwendi is back at the clinic where she had already been a nurse. But now she has a mental health expertise.
Anybody, when you hear the word depression, what do you think about?
Kwendi immediately puts her new training to use when a woman who came in for diabetes treatment begins to show signs of psychosis. Kwendi puts the patient, Pauline, through a mental status examination she learned in class.
But you know where you are presently? You know where you are presently?
Pauline thinks the current year is 1979 and that a child crying in the neighboring ward is her own daughter. Kwendi and her supervisor decide to get Pauline's diabetes under control first. Then, if she still shows signs of mental illness, put her on psychotropic drugs and into counseling.
Normally, what used to be done in the past, patient will come, even if they have mental illness, nobody cares about that. We were only concerned about the physical ailment. So this is really a new hope for her, that we are able to discover the mental aspect and treat her, the physical and the mental.
The goal of the Carter Center program is to have 150 clinicians just like Kwendi fanning out all over the country within 5 years. Treating remote, rural populations remains the biggest challenge. One organization working to cover that need is the French group Médecins du Monde, working alongside Liberian Health Ministry trainees. Here in a war-torn part of the country, they present awareness programs.
In this sickness, the only thing that can help the people that is medicine.
And see patients for one-on-one counseling sessions, such as this 13-year-old boy who says he sees spirits.
So how the Gina is like?
Black.
Black? Dressed in black clothes or in black?
Black.
Looking black.
And Alex, whose violent behavior was fueled by drug use that started during the war.
He was hearing commanding voices.
He was hearing voices. Nurse Edmund Sokpa says Alex's improvement has been dramatic.
He was very much psychotic. You could not see him like a human or somebody who has that dignity. So seeing him at present very calm, stable, coming on regular visits, as compared to the past, he has changed.
And then there is Niyama, the 25-year-old PTSD patient. She is also receiving medication and counseling, but the clinicians say she has yet to truly open up about her wartime experiences. As Liberia works to put the trauma of its past behind it, Kwendi and her recently graduated Carter Center classmates say they will lead the way. And a new class of trainees is just getting started.
Kira Kay's story is part of our partnership with the Bureau for International Reporting.